Good morning, welcome, and thank you for showing up to our patient rheumatology symposium today. And I will be talking about lupus, it's Lupus Awareness Month, the month of May, so I am honored to be giving this talk today. And in general, I'm going to be going over what is the definition of lupus, what causes it, what are the different types, and then how do we diagnose lupus, and then how is it treated. First off, what is lupus? This is something that is not common, but it's also not so rare. And so it's important to note that this is a chronic autoimmune disease that can essentially damage any part of the body. This includes the skin, the joints, numerous internal organs. However, it is not a type of cancer. This is not something contagious, and it's not to be confused with immunodeficiency, which is the loss of or lack of ability to fight infections, such as can be seen in diseases like AIDS or HIV. And it can really range from very mild to moderate and sometimes life-threatening. So in America, about 1.5 million have lupus, and about 5 million worldwide have some form of lupus. Every year, there are about 16,000 new cases that are reported in the US. It is a lot more common in women than in men, about 10 to 1, and especially between the ages of 15 to 44, but it really can occur in any decade. For men who get diagnosed with lupus, they can sometimes tend to have more severe lupus manifestations. And there are also, lupus can be seen more commonly in certain ethnic groups, including African American, Hispanic, and Asian Americans as well. These are some people in the media or in history that you may have heard of that have had lupus or have lupus currently. Seal is a singer, and he has a form of lupus called discoid that causes scarring of the skin, and that's what you can see on his face. Those are the scarred lesions. Tony Braxton, a singer, Nick Cannon, who's an actor and entertainer, they both have lupus. And Flannery O'Connor was a writer who actually died at a very young age, at 39, related to lupus complications. And Ferdinand Marcos was a former president of the Philippines, and he was also thought to die from lupus complications, but at a later age when he was 72. So what is lupus? And what causes lupus? And we know that it occurs in people who are, when you're born with a set of genes that can predispose you to getting lupus, and then you're exposed to certain triggers in the environment here that can then turn on the genes and then cause this immune system to essentially attack different parts of your body. We know that there are several chromosomes that are associated with the development of lupus. However, there's a lot more than just genetics that come into play, because people who have lupus, only about 10% of them have someone else in their family that may have lupus. And also, children who are born to parents who have lupus have only about a 5% chance of developing lupus themselves. Even in identical twins, you have one twin who has lupus, the other one may only have about 30% risk of developing lupus. So there's a lot more of these other environmental factors that come into play, and that includes infections, certain exposures to medications, sunlight, and stress right here is a really big one, because this really does affect your overall health and your healthy immune system. And Dr. Shibuya will be talking more about that later this afternoon. And of course, there's, again, just a reminder, there are certain ethnicities that lupus occurs more commonly in. However, it really can span all races, all ethnic groups, all decades, both men and women alike. So, to summarize, basically, in someone who has the genetic susceptibility, who is then exposed to certain triggers in the environment, for example, UV light, it causes dysregulation of the immune system, and this can result in the production of antibodies that mistakenly attack normal healthy tissue. And this can also produce molecules that go on to promote inflammation, and this is where all of the damage happens. The name lupus comes from Latin, and it means skin mauled by a wolf. And that's basically this classic appearance of a butterfly-shaped rash on the cheeks that a lot of patients with lupus will have. There are 4 different types, and the most serious and common form is systemic lupus, but there's also skin-only forms of lupus, and there's a type of lupus that occurs in newborns called neonatal lupus, and even drug-induced lupus, which can be self-limited if you remove the drug. So systemic lupus can affect numerous different organ systems, but everyone's lupus is unique, and so what may be involved in one patient may not be involved in another. For example, someone could have a rash and some joint pain, but another person with lupus might not have any of those symptoms, but they may present with fluid and inflammation around the lining of the lungs or the heart. They may have kidney problems. So just because someone looks normal on the outside doesn't mean that they can't have lupus. This is a skin-only form of lupus, and sometimes it can be associated with the systemic form as well. There's a acute cutaneous type of rash that results in this appearance when exposed to the sunlight. And sometimes there's these antibodies known as SSA and SSB that can be associated with this type. Again, some of these patients also have the systemic form of lupus. However, there's a chronic cutaneous or discoid lupus that really only affects the skin, and even though it's not causing any internal organ involvement, it can be quite disfiguring, and people can be really distressed about this because you can have permanent scars and hair loss that never grows back. Fortunately, though, this type of lupus usually does not is not associated with the systemic form. Only 10% really develop the systemic lupus. The neonatal lupus is occurring in newborns, and this is as a result of the antibodies that are present in the mother. These SSA and SSB antibodies can pass through the placenta, and this can cause about 2% risk in the newborn of developing this type of lupus. It's usually mild, but it's a transient, temporary rash. Sometimes their blood counts can be low, abnormal liver function tests. And the good news is that these manifestations usually resolve once these antibodies start to leave the baby at about 6 to 8 weeks. Rarely there can be more permanent side effects, certain conduction block, heart block. Some of these babies might require pacemakers for the rest of their lives. And even if the antibodies go away, this child then has about 5% risk of developing lupus themselves later on in life. But for the most part, most of these children have this temporary presentation, and then they typically do quite well later on. Drug-induced lupus is pretty much lupus that's induced by being exposed to certain medications. Really, there's hundreds of medications that can cause this, but again, they present with the classic symptoms of lupus, but then once you stop the drug, the symptoms will go away. And symptoms are, again, usually mild: fever, joint pain, rash, inflammation, and then there are different blood tests that distinguish this type of lupus from the systemic form. Something called the antihistone antibody that's present in 95% of those that have this drug-induced type that are not seen in the systemic lupus. So that really helps in diagnosing this. It's very rare to have severe, organ involvement. Simply stopping the medicine will allow this to resolve, usually in a few months at the most. And sometimes if these symptoms persist, we can use some medications such as non-steroidal anti-inflammatory drugs as ibuprofen and Aleve, and then prednisone if those types of drugs fail. So even though there's a whole bunch of medications that can cause this, these are the 4 most common that are known to cause drug-induced lupus. And interestingly, down here we have TNF inhibitors, which we use actually a lot in rheumatology to treat other autoimmune diseases such as rheumatoid arthritis. And so in order to be able to diagnose this, we have to have a suspicion that maybe this lupus is due to a drug that was started a few weeks ago. And stopping the drug will usually allow this to resolve. This slide is to illustrate the fact that there are very many variable different symptoms. Again, ranging from this the butterfly rash, loss of hair, and even as severe as having blood or protein in the urine because of kidney inflammation. And from the top of the slide down to the bottom, it's going from the most common to the least common. So, you know, the majority of people will have any number of these symptoms at the top. But here at the bottom, you can have seizures and abnormal blood clotting problems. And so sometimes it can be life-threatening or organ-threatening, but most people present with, you know, fever, joint pain, and rash. So if any of you have watched House, it's a medical drama on TV a couple years ago, and this is a doctor who is known to say it's not lupus because, you know, usually all of these mystery diagnoses, they imitate a lot of different diseases, but sometimes in order to know that it's lupus, we need to have make a clinical diagnosis. It's not just based on one test. We have a combination of the medical history, including a complete physical exam, and then a lot of blood and urine tests that can help to kind of piece everything together. And so because lupus can mimic and imitate a lot of other conditions, sometimes it can take a while for it to be diagnosed, sometimes months up to years before you can really arrive at the right diagnosis. So in order to, you know, kind of be able to help us diagnose lupus, the ACR initially, the American College of Rheumatology, created this list of measures that, you know, if you have 4 out of these 11 things, then the chances that you have lupus is very high. And so some of these are going to be you know, symptoms like having ulcers in your nose or mouth, having arthritis, but then a lot of these other ones can be blood tests like the anti-nuclear antibodies that I'll talk about later. You might have protein in the urine, abnormal blood counts, neurologic manifestations, and so it's really a wide spectrum of symptoms, but again, 4 out of these 11, and it's going to be a strong chance that you have lupus. And here's another set of criteria that essentially is the concept is the same. You know, at least 4 from this column, and then at least 1 abnormal laboratory test from this other column, and it's a strong chance that you may have lupus. So other common symptoms in lupus, these are not specific to lupus because they can be seen in so many other diseases, include fever, weight loss, and not feeling well. You know, sometimes that can be seen in diabetes, that can be seen in cancer as well. But these are very common symptoms in patients with lupus. We have Raynaud's phenomenon. That's this right here in this picture is illustrating the color changes in the fingertips. That's a result of either stress or cold that induces spasm of the arteries in the fingertips, and so there's loss of blood flow, and then the fingers can turn white. There can also be blood vessel inflammation, and then you can also have a lot of hair loss and scarring. I want you to pay attention to this heart right here, because for the rest of the presentation, I wanted to highlight the importance of how lupus really impacts the heart. And it's been shown that young women who have lupus actually have a greater than 50-time risk of developing a heart attack than their peers, because lupus inflammation actually, you know, gives you a high risk of cardiovascular disease. And the overall mortality rate is at least 3 times higher as well. There's also higher risks for developing certain types of cancers, lymphoma and lung cancer. There's a higher risk for infections in lupus, and especially if you're on prednisone, because prednisone is known to suppress the immune system. And you can also have an increased risk of bone loss, and avascular necrosis is a death of bone tissue as a result of poor blood flow. So these are all of the complications that we're hoping to prevent when we treat lupus. It's not just to treat the symptoms, it's also to prevent complications from developing later on. So what is the ANA blood test? This is an anti-nuclear antibody, and it's a simple test that basically detects for the presence of these antibodies that are mistakenly attacking normal healthy tissue. So if you have this test positive, it doesn't mean you have lupus. It means that you have antibodies directed against normal healthy tissue. That may or may not mean that you have a disease. And so on the slides previously I illustrated that, in order to come up with this diagnosis, you need to have a lot of these symptoms. There's other tests that help to support the diagnosis, and this is just one of those tests. But this antibody can be seen positive in a lot of other autoimmune diseases, such as rheumatoid arthritis, some autoimmune thyroid conditions, multiple sclerosis, which is a neurological disorder, can also have the presence of this antibody. So it's a helpful test, but it's not the only test that we do for lupus. And having a positive ANA does not mean that you have lupus, absolutely. So this is an issue of Time magazine. It came out about 12 years ago, and it states, the surprising link between inflammation, heart attacks, cancer, Alzheimer's, and other diseases. And so it's not so surprising anymore. This is kind of old news, because we now know that inflammation really is at the heart of a lot of these chronic conditions. And so how do we test for inflammation in people who have lupus? And that's really based on a series of blood counts. Complete blood counts can be low in people who have a lot of chronic inflammation from lupus. We also check the kidney and liver function. We check the urine for the presence of protein and blood, because sometimes that's an early sign of inflammation in the kidney. There are also 2 blood tests that we can use to actually quantify the level of inflammation in the blood, and that's the ESR and CRP. And we can also determine how active is the lupus, how active is the immune system based on these antibodies and these proteins. So usually when I see my patients with lupus for follow-up, these are the tests that I always order at every visit, and that's why we're able to capture any abnormalities early on, because when detected early, we can be more aggressive about treating it and preventing the inflammation from progressing further and causing chronic damage. So I always get asked, is this something that I have lupus, am I going to have it for the rest of my life? And there's 3 different paths that it may take, but the vast majority of people have chronically active disease. And so we know now that this is something that, there's no cure, but we definitely have a lot more effective treatment these days to treat it and keep it under control. And other people may have what's called relapsing and remitting, where the disease can go quiet, but then there will be intermittent flare-ups. And then some few patients may have quiet disease that may last for long periods of time. But for the most part, we have to be very careful with monitoring for all of these symptoms and making sure that we don't have these flare-ups. So the treatment approach to lupus is a combination of medications to control the inflammation, but it's also very important to prevent these flare-ups by keeping your immune system healthy, maintaining a healthy, active lifestyle, and also by doing a lot of measures to screen for and prevent cardiovascular risk. And a lot of this will be guided by education and support. So in order to prevent lupus flares, what can you do? And this is very important to try to minimize your exposure to sunlight, because we know that the UV light can activate the immune system, because there's actual immune cells that are on the surface of the skin that can be activated and triggered by sunlight. So wearing protective clothing, they have clothes that actually are SPF now, so you don't have to slather yourself with sunblock, but also trying to avoid sun during the daylight hours. Managing stress is very important, and also abruptly stopping or discontinuing medications can cause lupus to flare. So it's really important to stay on the medications prescribed for lupus and try to limit exposure to infections. It's interesting because I read about, in certain areas in Asia where they wear these masks, and it's really a courtesy. People wear these masks because they don't want to get other people sick, and so that's kind of their culture over there. But trying to stay away from sick people, wash your hands, get all of your immunizations every year. Pregnancy is very interesting because a lot of times some people who get pregnant, their lupus can get better, but for the vast majority, lupus usually flares up during pregnancy. So it's always important to talk to your doctor and plan ahead, rather than trying to get pregnant on your own. What are some things that you can do to keep your immune system healthy? Regular exercise, adequate sleep is very important for the immune system, and then stopping smoking, because we know that cigarette smoke is actually one of those things that can trigger the immune system, and then making sure that the immunizations are up to date every year. And lupus is really a team approach with you at the center, and it may involve the help of your primary care doctor, the rheumatologist, but also other specialists and other providers that really, depending on what your symptoms are, you might need the help of all of these different providers. And in trying to treat lupus, the doctor over here is focused on trying to prevent all of this inflammation and organ damage. And so we do that by asking a lot of symptom questions, we order a lot of tests, and then we treat with various different medications. But we also try to address the patient concerns about body image, because sometimes these rashes can be really disfiguring. We try to make sure that physically and mentally, we address functioning there with fatigue and pain, depression, anxiety. And so it's really a team approach. The doctor's trying to work with the patients to treat the whole disease. So before starting on treatment, it's really important to go through all of these discussions about your risk for chronic infection. So we always test for tuberculosis, hepatitis, because oftentimes the treatments for lupus can actually cause these diseases to reactivate. We also recommend updating all your immunizations so that you can protect your immune system. We always want to be informed about any pregnancy plans before you get pregnant. We've learned that lupus can cause poor pregnancy outcomes in the mother and the baby. And so that's why we want to make sure your disease is controlled before you get pregnant. But also, a lot of the medications that we actually use in lupus can be harmful to the baby, can cause birth defects. And so we need to know ahead of time. And if you don't want to get pregnant, then we always advise birth control. And then, of course, trying to limit prednisone use, protecting your bones, and then trying to use other agents to try to minimize the effects of prednisone. And then the patients can really educate yourself, your family, and friends about lupus and be able to communicate your symptoms well. And there's a lot of questionnaires out there. This is just an example of a lupus symptom tracker that kind of allows you to rate how you're feeling, and something that we can monitor from visit to visit, because that can help determining how active is your lupus. So, you'd be surprised to find that there's only 4 drugs that are available that are FDA approved for the treatment of lupus. And the first one was aspirin in 1948. That's a long time ago. And then about a decade later they had prednisone and Plaquenil, but it wasn't until 2011 that Benlysta became FDA approved. So really, there's not a lot out there, but we're hoping that we'll be able to find more. So starting off with aspirin and these non-steroidal anti-inflammatory drugs, that would be like ibuprofen or naproxen, and these are usually used to treat the joint symptoms, the body aches, the muscle pains. And we always use these drugs with caution, because even though they're available over the counter, doesn't mean they're safe. They can have potentially can cause kidney problems or be irritating to people who have sensitive stomachs, and rarely it can cause bleeding ulcers in the stomach. And so even being on these drugs can increase the risk of getting cardiovascular disease. So we always like to be cautious when we use NSAIDs. Corticosteroids, the big one being prednisone, can increase organ damage if used long-term for at high doses. And you have this here, it says prednisone, the all-time eating, shaking, bone thinning, weight gaining, bleep making, so you can never sleep again medicine. And it's funny, but it's true. These are all the possible side effects of prednisone. And so even though it's a great medicine to control inflammation, we really want to prevent this bone loss and a lot of these other side effects like diabetes and weight gain. So we need something better than prednisone. There's Plaquenil, which is a cousin of the malaria drug, chloroquine. And so hydroxychloroquine is very effective for treating the skin and joint symptoms in lupus. It's, for the vast majority of people, it is very safe, and it's very well tolerated. Doesn't really cause any laboratory abnormalities. It's doesn't cause stomach upset, but rarely it can deposit in the back of the eye. And that's a side effect that all the ophthalmologists fear, because that can lead to permanent visual problems. And so even though it's a rare side effect, we always have to talk about it. And the guidelines say that we should get screening every year. So patients that I put on this medication have to make sure you go see the eye doctor every year so that they can test for this problem. But hydroxychloroquine is a very good drug. It's actually found to decrease the risk of heart attacks in people with lupus, and also has been shown to increase long-term survival. So I try to have all of my patients with lupus on this medicine unless they're absolutely allergic to it or they have this problem in the back of the eye. And then lastly, we have Benlysta, and this is a newer drug, again, came out in 2011. I wanted to talk a little bit about how it works. And so in lupus, what happens is that you have these B cells that make antibodies. And these B cells are normally not supposed to make antibodies that attack your normal healthy tissue. If you have these types of B cells, they're supposed to die, so then you don't have this production of these antibodies attacking you. So there's a factor called BLyS, it's a B lymphocyte stimulator, and these factors actually allow for these abnormal B cells to survive longer, and they go on to produce antibodies and keep causing inflammation, and it keeps cycling round and round. Well, this Benlysta is a drug that is an antibody against that factor. So essentially it's an antibody that's blocking the production of these autoantibodies. So by decreasing antibody production, it actually can decrease inflammation. And it's been shown to reduce severe flares of lupus. It lowers the levels of antibodies that can be detected in the blood, and people who are on these drugs can actually, on Benlysta, are able to lower their prednisone use by about 50%. It hasn't been approved for the use of severe lupus symptoms, so anything with lupus kidney or brain-related lupus manifestations, it hasn't been approved for that, but it's really good for, again, the skin and the joint and some of the other organ manifestations of lupus. It is given as an IV infusion, so it starts off as a loading dose every 2 weeks for the first 3 doses, and then after that, every 4 weeks. And the benefit of having an IV medication as compared to an oral medicine is that we can increase compliance, so we know that you're getting the medication because you're coming into our office every month. Secondly, people who have stomach problems and are not able to swallow a lot of pills, having an IV medicine can be quite ideal. And then you get the support, in-office support, because there's a nurse there, they can answer your questions, and sometimes being in an infusion room with other patients, people can share their stories and kind of provide each other support that way. Because there's only 4 approved medicines, sometimes we need other medicines to help control the symptoms, and so we borrow from medicines used to treat other diseases. And that includes, for the arthritis and joint pain symptoms, we use medicines that we use in rheumatoid arthritis, and that would be methotrexate and leflunomide. And then we also use azathioprine, which is another immunomodulator that is used to treat other inflammatory conditions like inflammatory bowel disease. Cytoxan is actually a chemotherapy drug that is used to treat really severe lupus symptoms, such as lupus in the kidney. And then there are a few more investigational therapies that have not been FDA approved but can sometimes be used if the other medications don't work. We also treat specific symptoms such as the Raynaud's, color changes in the hands. Lifestyle modifications can be very helpful, as well as a blood pressure lowering medicine that can open up those blood vessels and prevent the spasming in the fingertips. And then we also like to screen for and treat all of these risk factors for developing heart disease, and that would be statin drugs to lower cholesterol, and then other things like recommending smoking cessation and treating hypertension, diabetes to prevent the risk of heart disease. And then we also have other, I put hydroxychloroquine in here because it's really not an immunosuppressive drug, and it is helpful to reduce flares and limit organ damage. And it also actually improves survival. It can improve the cholesterol levels, and so it's good for the heart. I call it vitamin H, so it's really mild for the most part. Vitamin D may also have some cardiovascular benefits, and so we always like to recommend additional vitamin D supplementation if the level of vitamin D is below 40. And I would say that at least 80% of my lupus patients that I check their vitamin D levels, they're always lower than 30. And so for whatever reason, I think maybe by avoiding sunlight, they're not getting enough sun exposure to help produce that normal vitamin D. There's also synthetic DHEA. It's not FDA approved, but it is also shown to reduce lupus flares and allow for the reduction in the usage of prednisone. And there may be a mild protective effect on bone loss. There are limitations to the therapies that we have available, and that would be regarding the immunosuppressive drugs, there's a risk of infection. There is a slight increased risk of cancer, and the Cytoxan that we use can cause infertility. Contrast it with prednisone, and these are a lot more long-term side effects. And so I'm actually a lot more worried about someone who's on prednisone than someone who's on immunosuppressive drugs. And so that's why it's really important to see your doctor frequently, monitor for any side effects, and be able to prevent the development of any complications. That being said, we know that before we had medications to treat lupus, people would die from lupus very young. So with these drugs, people are living longer, they're able to live fairly normal, healthy lives. And so these drugs have really been very helpful in helping to manage lupus. We just have to be aware of what the potential side effects may be. So at every visit, I also like to screen for and prevent complications, and that includes screening for and treating blood pressure, cholesterol, and blood sugar, so screening for diabetes. We always check this urine test, and the reason for that is actually to detect the protein levels in the urine. If it's greater than 500, it's a sign that you might have significant inflammation in the kidneys that need to be treated. We also counsel regarding pregnancy. We always recommend stopping smoking or abstaining from smoking. We encourage exercise. Again, try to take the hydroxychloroquine and then limit prednisone use. And so how can you take control of your lupus? We know now that it's really important to manage stress. And so you need to get plenty of rest, get plenty of exercise, eat a healthy diet, and maintain a healthy weight. Also, the protection from the sunlight that I talked about previously, wearing SPF, wearing sun protective clothing, and also prevent yourself from getting sick. And so that includes vaccinations, washing your hands. You can go around and wear that mask to prevent getting sick if you're in crowds. And then also inform your doctors before you're considering becoming pregnant. Quit smoking, educate yourself and your family and friends. And so there are online resources. We have a Lupus Foundation of Northern California, and they're actually going to be putting on a patient symposium in Sacramento in 2 weeks on May 21st at the Mercy Hospital. And so you can find out more information at their booth next door. And so in summary, I just wanted to close the talk so that we can have time for some questions. But remember that lupus is a very complex autoimmune disease. There is a role of genetics combined with some triggers from the environment. There are 4 different types, and there are only 4 FDA-approved medications, one of them being prednisone, which we try to limit the use of by using some of the other medicines. And because the risk of heart disease is greatly increased in patients with lupus, it's always very important to maintain a healthy lifestyle through prevention and screening, and then education. So again, these are some links to some of the websites that we have. The lupusfoundation.org, it's lfnc.org. Also, drshibuya.com or fremontrheumatology.com is a link to the office website. And there's also usinlupus.com that has a lot of good resources. So, thank you. Can I help answer any questions? Anyone have any questions that I can answer? No? Yes.
I was wondering about chelation and also epileptic brainwaves. That you don't have epilepsy, but you go in and out, and you forgot what you call it, just lose concentration, and then in a few seconds it comes back. Chelation, can this help to manage weight or weight loss? Is it helpful in any manner, like taking out bad stuff from your system?
Okay, so I think what you're asking is whether chelation therapy can help in managing weight loss and being able to remove any potential like toxins in your body. And so I think that is more in, I think Dr. Shibuya might be able to answer that question a little bit better. I don't have a lot of, there are other holistic approaches that can be used alongside a lot of these traditional medicines and therapies that we use in lupus, but I don't have personal experience with them myself, and we don't have a lot of research out there. So I'm not able to comment on that, but we can talk about that a little bit more later. Okay. Yeah. Okay. Thank you very much. I'd be happy to stay up here for more questions if you have any after the talk.